My name is Kelly. I'm here with Dr. Ashinoff. Dr. Ashinoff is a plastic surgeon who also specializes in lymphedema.
Kelly and I are going to talk a little bit about lymphedema today. Up until recently, the only treatment for lymphedema has been decompressive massage and compression wrapping, but it's very exciting because some new surgical treatments have become available, and we're going to tell you a little bit about them today.
March is Lymphedema Awareness Month, so we will be answering some of your questions regarding lymphedema. Dr. Ashinoff, why is lymphedema a hot topic and area of concern among the breast cancer community?
So a lot of women who have breast cancer undergo surgical treatment, which may include a mastectomy, and oftentimes one or more than one lymph node will be removed at the time of the procedure, which can predispose them to lymphedema. And the percentage is up to 20-25% if you've had a full axillary dissection, meaning all of the lymph nodes, well, many of the lymph nodes under the arm were removed. And if you've only had a sentinel node biopsy, which means 1 to 3 nodes usually, the percentage is a lot lower, but it's not zero, so it's probably 1 to 5%. And it may occur immediately, and it may occur in a delayed fashion. We really don't know why that happens and who it's going to happen to, so most of the treatments have been tailored toward treating it when it does occur.
If you have lymph nodes removed, does that mean you'll definitely get lymphedema?
No, not necessarily. And again, no one knows why or when someone's going to get lymphedema. We just know that the more nodes that you have removed, the more likely you are to get it, but that number's not 100%.
How high are the risks after axillary dissection? Are you at risk for the rest of your life?
You are, and the risk is, in the literature, is probably around 20% over the course of your lifetime. So it's important to be aware of what the symptoms are, and if you do notice the symptoms, get treatment early.
Do additional treatments such as chemotherapy or radiation, in addition to breast cancer surgery, increase the risk of lymphedema?
That's a good question. Absolutely. Chemotherapy has not really been shown to affect the occurrence of lymphedema. However, radiation alone or with axillary dissection certainly can increase your risk of developing it. And it's not only confined to breast cancer patients. People who have been treated for melanoma or pelvic malignancies are also susceptible.
Is there any way to prevent or lower your risk?
There's really nothing we know to do to prevent or lower your risk of developing lymphedema. It's important to maintain good hygiene and take care of the arm or leg that we're concerned about. And if you do develop any signs or symptoms of swelling or infection, just to recognize them and get treatment early.
Are there any everyday activities that could cause or increase the risk of getting lymphedema?
And truthfully, no. There's nothing that's been shown to cause lymphedema. Exercise is safe, and in fact, it's encouraged. So you really don't need to limit yourself after surgery or radiation that may predispose you to lymphedema.
I've heard recommendations about wearing a compression sleeve or glove while on a flight. Can you contract lymphedema while flying?
Well, there's nothing to show that flying will cause lymphedema or make your lymphedema worse, but that pressure in the airplane cabin is not as high as it is at sea level, so if you're worried about it, there's really no harm in wearing a sleeve or a glove when you're on a flight. If you don't have lymphedema, you don't have to, but it's not something that's going to hurt you, so if it makes you feel better, go right ahead.
Are there daily exercises that someone can do that has lymphedema?
Well, one of the mainstays of treatment for anyone with lymphedema is occupational therapy, which includes the decompressive massage and the wrapping, and many of those practitioners are trained in showing you various exercises that may improve your range of motion. Often, if you've had surgery in the axilla or armpit and or radiation, people can develop tight contractures, so the physical therapy to help regain your range of motion there certainly is helpful. But if you have no limited range of motion issues, then you don't necessarily need physical therapy.
How do you manage lymphedema following a breast cancer treatment?
So after breast cancer treatment, if someone develops lymphedema, the most important thing is to recognize it early. We think the earlier you recognize it, the more successful we are in treating it. Particularly, you want to prevent the development of chronic inflammation and skin changes in the arm or leg. So the first thing we'll do is recommend the physical therapy that we've discussed already. If you can avoid allowing the arm to become swollen and filled with fluid, you can avoid that chronic inflammation that can lead to fibrosis and skin changes. Once they've optimized the therapeutic portion of it, we can then consider them for lymphedema surgery, which may include a procedure called a lymph node transfer. It may include a lymphovenous bypass or both. And in certain situations, we'll use liposuction or direct excision to treat the lymphedema. And we have a very specific protocol depending on how the patient presents to us.
In regards to the lymph node transfer surgery, what is the success rate?
The studies show that about 75 to 90% of patients who have had axillary dissection and radiation will derive some improvement from lymph node transfer surgery, particularly if we're dealing with the upper extremity. So we think a lot of it has to do with releasing the scar tissue and then replacing that tissue with healthy tissue that's not been exposed to radiation. The tissue we transfer also happens to contain lymph nodes, and we know that after a period of time the body will form new lymphatic channels, and we can see this on MRI, and many patients will have some improvement immediately after the procedure, and we know they haven't developed new lymph nodes in 24 hours, which leads us to believe that the scar release also plays a role, and then we usually give that result about a year to mature. By the end of the year, if we're going to see improvement, we usually do, and the 75 to 90% number is both subjective and objective. So many patients will feel that their arm is softer or less heavy or not quite as swollen, and many times we'll be able to measure a decrease in the circumference as well.
Can someone be treated for lymphedema at the same time during breast reconstruction?
Yes, often we can combine the two procedures. So if we're doing an autologous reconstruction, that means using your own tissue, most often the tummy tissue. We can take the skin and fat we use to create the breast and leave the lymph nodes attached that we often use to reconstruct the underarm area and perform that in one procedure.
I want to thank Dr. Ashinoff for taking this time and educating us about lymphedema.
Well, thank you for talking with me.